My name is Jillian Kelton, and I'm the Director of Partnerships for Daybreak Health. I recently joined Daybreak after a 20-year career in the Boston Public Schools, most recently as their Chief of Student Support. I'd like to thank you all for joining us today to discuss some important topics, all of which are directly related to the increase in need for equitable and accessible school-based mental health services. At Daybreak, we partner with school districts across the country to provide personalized mental health support to help each student reach their full potential. We are the leading school-based teletherapy provider, and our programs are designed to give students access to high-quality, affordable, and culturally competent care to meet their unique needs. Today, we have three wonderful panelists with us, all of whom have extensive knowledge and experience working in school districts and supporting the diverse needs of students. During today's webinar, we're going to focus on what trends they are seeing in their districts in regards to the increase of mental health needs amongst their student populations and what actions they are taking to support those needs. But before we dive in, I'm going to invite each of our panelists to introduce themselves and give a brief background of their current positions, what their role entails, and what districts they're working in. So I'm going to hand it off first to Jeannie Larberg.
Good afternoon. I am Jeannie Larberg. I am the District Director of the Whole Child, which encompasses all of our MTSS behavior system, and then also our comprehensive school counseling program and counseling and behavioral health services throughout our district. We are a district of 10,000, and we're in Washington State, Sumner-Bonney Lake School District.
Great. Thank you so much, Jeannie. Next, I'd like to hand it to Mariana Torres.
Hi, everyone. My name is Mariana Torres. I'm the Director of Equity and Access in Apple Valley Unified School District. We're a small district. We wear many hats. Part of the charge here is we support counselors across TK through 12, family centers, college readiness, AVID, family engagement, and parent education.
Thank you, Mariana. And last, but certainly not least, we have Abby Liberstein.
Hello, I'm glad to be with you all today. Thanks for having me. I'm Abby Liberstein. I'm the Director of Student and Family Services for the Alamance-Burlington school system. That's right in the middle of North Carolina. We have about 20,000 students, maybe a little bit more, and my department works with the counselors, social workers, nurses, McKinney-Vento, anything related to mental health comes through us.
Excellent. Thank you all for those introductions. And now let's get into the discussion. So having recently been in a large public school system myself, I know that since the pandemic, there has been a sharp increase in the mental health needs of our students. Before leaving Boston, we were seeing not only an increase in the number of students needing support, but also in the acuity of those needs. How are you seeing that play out in your school districts? And can you talk about the trends you're seeing? Jeannie, let's start with you.
Thank you, Jillian. So one of the trends that we have been seeing in Washington State and in Pierce County for our school district is something that is being seen across Washington, which is since 2013, we saw a decrease in workforce shortage with people who are working in that mental health field. And then with the pandemic and the isolation, increase of lack of connections with school personnel and those services with social, emotional, and mental health type of supports, as well as teaching, that we have seen a big increase in students with mild to very acute, extreme type of mental health concerns that might be imminent, and mostly around some of those other mild to moderate kind of behaviors around anxiety and depression. But we also see conduct disorder and OCD and those types of things are going on in our school district. One of the pieces that we are seeing is also our ERs are not able to handle the suicide ideation or homicidal ideation of our students in Sumner-Bonney Lake School District, and that has been very traumatizing. So we have been working really hard with what we call our crisis mobile to enhance that system in our Pierce County so that our students do not sit in ER for hours upon hours and get re-traumatizing, saying their same story over and over to many, many people.
Mariana, do you have anything to add? What trends are you seeing?
Well, one of the things that I find interesting is that, in all honesty, we saw these trends coming before the pandemic hit. We saw that there was an increase in the anxiety, in some of the depression, and some of the suicidal ideations. We were seeing sort of the storm coming. And then the pandemic hit. And depending on your situation in the pandemic, all of those things added up, not just in the family and in the finances and in some cases in the living situation, but in so many other different ways that created this snowball effect that truly made that a mountain and made that gap that we already had. Like what Jenny was saying, I mean, we already didn't have enough providers. And now you're going to do that 10 times over, and we're finding ourselves even more limited, and for that gap to be even wider for us to cover. So that has been a struggle, and we have had to come back, just like with the pandemic when we had to figure out how to do school in like 2 days. We had to come back and really say, okay, we cannot think inside of the box. We need to do more. We need to do different. We have to figure out different things to do. So that has been really the work since getting back in.
Yeah, sort of the pandemic fanning that flame of something that was already lit. Abby, talk a little bit about what you guys are seeing.
Just to echo what Mariana was just saying about having to kind of rethink how we're doing things, we've definitely seen increases in our number of students who are applying for homebound. And I don't know if every state has that, but that's like our least restrictive, I mean, that's our most restrictive option for students. And it's basically they get like 4 hours of instruction from their home. And so it does not equate to regular schooling. And we're seeing more and more students and doctors writing students into like a homebound situation for mental health and anxiety and those sorts of things. So we're really having to rethink what can we do for our students so that maybe we can get them back into the school or get them in a less restrictive option for school.
So now as we're seeing this rise in mental health needs and we're seeing the way in which it plays out in our school communities, I've noticed, and I noticed this in Boston, we are concurrently hearing more and more about chronic absenteeism across the country. And this issue is being spoken about all the time, and is really impacting students' ability to get access to instruction, for schools to lay eyes on them, to offer supports when needed. Can you talk a little bit about how you see these two issues playing out in your districts? Jeannie, we'll start with you again.
Yeah, attendance is one of those issues, especially coming back to in-school sessions instead of online. One of the biggest issues for us is attendance is always a concern, as well as our 504 students that are needing 504 accommodations. And in our district, attendance is a concern. So part of that piece is we do have some truancy boards, but really on my forefront is we have to do a lot of parent education around why missing school is critical, especially for students that are exhibiting those mental health symptoms of anxiety, depression, and how those evidence-based practices that therapists provide, CBT, behavior activation, all those things are so critical that if they don't come to school, they don't always have access. The benefit of Daybreak in this situation is that they can still get access, and then we can also work with the therapeutics providers with Daybreak, because our counselors are working with them. If that child is not in school, we're able to kind of make some kind of wraparound services to get that child back into the school setting.
That's helpful to hear, especially, you know, these webinars, we want to ensure also that we're allowing our participants to take practices home with them. So the parent education, the parent engagement, I'm sure is hugely helpful, and, you know, important, just increasing that bond with the parent and creating that collaborative relationship. Mariana, can you talk a little bit about how chronic absenteeism is showing up in your district?
Well, I think that it's worth mentioning that we're still recovering. I mean, our numbers look a lot better than they did last year and the year before, but some of it has to do with the fact that we send them home. Because of different mandates that we had in place, it made it very confusing for families that were already kind of confused to begin with. When we said, no, he can't be here. We have this situation going on. These are our health mandates. So So now we want them back. And they're like, well, wait a minute, now you want them back all the time? But when we're going through our SART and SART process, we try to take an integrated approach. Like at the end of the day, it cannot be a got you situation, because that's not anything that
SART and SARB means. What SART and SARB stands for?
Oh, yes, it's our student thank you. I apologize. We live in acronym world and in academia. It's our student attendance review. One is our team, which happens at the site. And then when that one is struggling to work, we have our SARB, which is our actual student attendance review board, which actually has kind of a bigger district attorney, other services that are outside of our local agency. So we have our district nurses, we have our family center coordinators, we have our counselors, we have our child welfare and attendance. We have a pretty thorough team that actually comes in and says, what's up? What's going on? Is it the student has a need? They need clothes, they need food, they need transportation. What is it? And a lot of what we have come across that actually kind of prompted some of the conversations around giving family therapy services is the fact that, especially in an elementary school setting, those students don't control how they get to school, right? Or who gets them out the door. And if mom is struggling so hard with her own anxiety or her own issues of making sure that she can provide this for the student, then we're still not having that student in that seat, which is where they need to be to learn, to make sure that they're okay, to do all the things that we need to do. So that was part of the thought of the whole child, and the whole child encompassing also who their caregivers are and how we can support that to make sure that they can get to school. Sorry, I went long on that one, but
no,
that
that's incredibly helpful. I think when we start to, shift our focus to remind ourselves that we have to help in creating, stability at home, and also extending our resources, as many as we can, into the home, that helps, the progress of our students, our young people. Abby, can you say some about what you're seeing?
Sure. In our district, we have been trying for the last probably 2 or 3 years to really push attendance and really have an emphasis that we don't let go, that we keep coming back to, and we've really noticed that we've needed to put some structures in place because every school was kind of doing their own thing. And we have close to 40 schools. So it just wasn't feeling very equitable then when some schools could offer certain services and supports to students that other schools couldn't offer. Or we're also in an area where there's still a lot of stigma around mental health. And so there's people in the community or in families or even some school staff that, you talk about anxiety and they get a little anxious themselves and like they don't quite know what to do with that. And so we've really just tried to work with like our leadership teams and then, kind of trickle down to the rest of the school staff as well to try to make sure that we've got supports at all the schools and that we're being equitable about that so that we can get students back in.
That's so important, that continuity of services across your district to ensure that there's equity in access and equity in the distribution of resources across the district. So when we begin to support this increase in needs, as well as supporting the severity in some of these needs, in schools, we refer to the varying degrees of support used for these needs as being tiered through the MTSS model, which I know you all know about, and I'm sure most of the participants do as well. When we talk about tiered supports, tier 1 can be thought of as practices that are addressing the well-being of all students, school-wide and in the classroom, addressing culture and climate in the school, as well as at the classroom level. Tier 2 supports are the ones that are addressing the mild to moderate mental health concerns, or that support the needs of students who are at risk of developing more severe mental health concerns based on factors that are usually largely environmental. And finally, the tier 3 supports are more intense and often happen outside of school or in a specialized educational setting. Jeannie, let's start with you. What do the tiers of support look like in your district?
Thank you, Jillian. Yes, so our tiered support, our MTSS specifically for behavioral health support starts, of course, first education with our educators. And that's around not only mental health, but behavior and those, again, classroom, school-wide positive supports, but also very methodically, and implementation and maintenance of the system is about what do we provide kids when they need something more. And whether it's mental health concerns, drug and alcohol, or any kind of behavioral health services, that also entails that tier 1 of how do we do mental health literacy for all grades? And what does that really look like, as well as coping skills for all grades? And providing that social emotional skill set that they need in a tiered system across all our schools. So then the second one is how do they access that tier 2 is really those tier 2 meetings using data, and then developing a plan. And we use some very specific strategies for that of what kind of interventions or support are needed at a tier 2. And then at a tier 3 is not specialized for us. So we say our IEP students or students that have SDI receive all services. So our tier 3 is really around the frequency, as well as the more intense services and behavior supports. And for that system, that could include our community partners that come in and work in our buildings with mental health. It could be our drug and alcohol people that come into all our secondary buildings. And that also includes all of those community agencies outside that are part of that system. But it also includes the team building that right system. And it doesn't matter if a student has an IEP or is a gen ed student, they get all those services regardless. So just because a student receives services, for example, with Daybreak, outside of the school setting, or even during the school setting through telehealth, they still get the other provided services, whether it's a special ed student or not. So they still get those tier 2 interventions that were set up. They may get more intense and more frequency of those supports in tier 3, but they still get their mental health counseling or drug or alcohol counseling in that setting. So that's how we do it in Sumner-Bonney School District. And it's also part of our state legislative services, or OSPI is what we call it, that mandates that we're supposed to have at MTSS-B, and maintaining that system so all students' needs are met. And that's our goal in Sumner-Bonney School District. It's all students should have their needs met regardless of what kind of category or supports have been already implemented, that we try to provide all those pieces.
That is incredibly helpful to hear. And, you know, I love the way you put it, mental health literacy for the teachers, and, you know, providing that professional development, the education for the educators. It's so important because we can't expect people to know what they don't know. So really being, you know, so really providing those opportunities for the people who are in the classrooms. So Abby, do you want to talk a little bit about what the tiers look like in your district?
Sure. We're not allowed to call them tiers anymore. We have to call them core, supplemental, and intensive. So I'm going to try to do that today. So our core for mental health really goes right along with like the behavioral systems and the SEL, social emotional learning systems that we have in place, and the things that our counselors and social workers and teachers do to teach the students, you know, throughout the day, those different skills. But we have 3 options for the supplemental and intensive for mental health. The first one is Daybreak. We only have that at secondary schools right now, so just middle and high schools. The second one is we have an MOU process for like co-located services. Basically, community agencies can partner with the school district to be able to come in and see students at school. That is really messy right now. We're having to clean that up because just some, I don't know, it just wasn't started out maybe the way that we would have liked to. Now that like we know better, now that we've been trying to do that for a little while and just seen some of the things that don't work with that. And so we're working on that piece and kind of cleaning that up. But the third piece that we have, and we use this more for like our intensive students, is we actually have 4 people on staff in the school district that are called mental health specialists. And so school support teams can refer students to the mental health specialist. They serve K-12. And so there's like a little referral form, and then we have procedures for students to be able to see those providers. And there's like a family component to that as well.
Excellent. Jeannie, I want to come back to you for a second. So you talked a little bit about legislation and policy sort of supporting the work of MTSS-B in your district. Now, I'm not exactly sure of the timeline of when that was sort of implemented, but has the rise in mental health needs forced you to sort of reimagine the way in which systems of support or access to those systems are structured?
That's a really good question, Jillian. I think one, I'm on 2 legislative boards, one at our state as well as Pierce Pierce County. I think one of the things that has come out is the need for mental health. And so we have a lot of us who are really concerned about the systems instead of the whack of the mole. Because what happens, and I think Abby's even talking, it gets messy. I have over 8 providers coming into our school district also. And so looking at how do you have a system that supports that so that not every child needs all those supports. And that's was based around 2 systems, multi-tiered system of support for behavior. And then the other one that is mandated in our state is comprehensive school counseling program, which is overlaid. What is counselors doing at tier 1, tier 2, and tier 3? So that benefit of having legislative background and legislative support, we don't always have the funding that's in this year's legislative. We don't always, school districts have a lot of funding, but we also know, being one of the pioneers in MTSS-B in our state, is that you have to start somewhere in that implementation. And even though we started in 2015, it's that maintenance of that integrated with our comprehensive school counseling program that really is the benefit. We see the most bang for the buck. And that you don't have to always have a lot of money, but you have to have absolutely professional training with everybody from the superintendent to the janitor. I'll be honest. It takes that much work to get a system together so you're not whacking the mole, because that's what happens if you don't have that legislative support, is you're just putting out one fire after one fire. And so when we have this system and make people work within the system, we see better results.
That sort of is a good segue to what my next question is. You brought up funding. So has funding been an obstacle in doing all of the things that you're talking about doing? And if funding has been an issue, what are ways that you've been able to become creative in funding school-based initiatives that are related to the mental health needs of your students? Sorry, Jeannie, I keep coming back to you, but you just point me. So coming right back.
Sorry. So passionate about this field, was in the mental health field prior to going into schools and teaching, as well as counseling. But in that role of belief that I have to get other people involved, that it really isn't always about funding. It's really about time and energy, being on legislative committees, going to all these other pieces that really takes effort of someone who is passionate about making sure our kids are being served in an MTSS system. So legislative, we get very little funding to start and implement and maintain your MTSS-B. But helping districts also across our state, we have lots of opportunities through OSPI that people can learn how to do this in their own building. And then for me, it's getting those agencies. I started out 10 years ago. We had one agency coming into our community, but by being part of a whole bunch of things like kids' mental health, Pierce County, being part of these Pierce County advisory council for how spending is done, being on legislative meetings, having people come together to say, here's what schools need, because they don't often hear from schools. So that is one of the pieces that I would encourage people to do, is get involved with all these community action teams, because you'll figure out there's people out there to help support and they don't understand the school system. And so part of that is, how do you move a system without all the money? And it's truly through all these connections that I've made, as well as getting community agencies. Like I said, right now I have 7 of them. I work with the local University of Washington through the UW Smart Center. It's having all these opportunities, and it really is seeking out. So if someone's excited to do that, that's what I would say. You really got to have someone in your leadership that's willing to go after some of those pieces of getting community agencies involved, as well as the funding. And universities are often a great place to start, because they have different kind of funding that will help our buildings.
That's all, those are all great ideas and practices. Mariana, I know that you are often very busy in the community and at community events. So can you talk a little bit about any obstacles you found in funding and sort of how the community plays into the work that you're doing in supporting the needs of your students?
So in California, we actually started the Community Schools Initiative a couple of years back, and our governor actually has put in quite a bit of money into what that could possibly look like, and servicing the whole child. And under this initiative, really there's a share power model that you really want to make sure that you embrace in regards to sitting at the table together. And I love what Jenny was saying, because that's basically in that share leadership model. We're listening to our students, we're listening to our parents, we're listening to our community partners, we're listening to everyone sit at the table and say, what are our assets? And
true testament to working in a school. Yep.
Sorry, we decided to start a test, which always never fails. So we want to make sure that that we're listening, but farther than just doing a needs assessment, it's that piece that comes with the funding that we have to look at our asset mapping. And like Jenny was saying, like who are the providers? What kind of mental health services? What kind of medical health services? Because we understand that at the end of the day, if it doesn't happen at school for some of our students and our families, it doesn't happen. So, you know, the funding, yes, we have therapists at the high school, that we actually have a therapist at each of our comprehensive high schools and our alternative high school. We have school counselors in our TK8s and high schools, but those are more on the academic side of the house. Daybreak provided the opportunity for us to leave the building, as we may say, because we do have other services like our Desert Mountain SELPA, which provides our regional assistance, comes into the building. But you know, if you have insurance, we can actually do a referral and get you partner up so that we have a warm handoff. But when they leave us, we don't necessarily know what happens. But yet we're in charge of making sure that they're okay when they're sitting in that chair. So coordinating these services and making sure that that's part of the plan. So for us, each of our planning grants and implementation grants through either any mental health initiative or through our community schools, and we made it a priority in our LCAP. And yes, we still talk acronyms. So that's our local control funding formula. That's how we get our unduplicated count that comes to us. But even that has to be educated through the community, because that plan that we have to do every 3 years, it's everybody's plan. So putting at the forefront our mental health, our SEL, making sure that it's what we're providing, and the way that we have that common language talking to everybody has been at the forefront of all of the work that we've been doing, because it cannot be in the back seat anymore. It cannot be something that we say, you know, well, too bad, your insurance took too long to get you some help. That's not on us. So we really have to step up and say, these are our kids. No matter where they are, they're our kids. So I think it's been a shift in everybody's mind, and in the funding we're seeing some of the same pieces, even though it's getting tight again. Those one-time fundings are drying up. So back to the drawing board, right?
Yeah, I think, you know, you hit on some really important points there. Just that, you know, the funding as an obstacle, it really is important to strengthen and sort of increase that connection with community and all of the stakeholders, right? That conversation is important, that we're all rallying around these students. You know, everybody has a piece of this to support these young people. Abby, can you talk a little bit about what sort of funding barriers or any obstacles that you're seeing in your district?
My district is in the middle of a financial crisis. There's actually like a huge meeting happening right next door right now about it. We are falling off that Esser cliff big time. So the thing that I like about Daybreak, and one reason that we went with Daybreak, was I knew, like from the beginning, that I was going to have to be finding funds to maintain it on my own, that like our district was not going to have that, our state was not going to provide that. I'm going to have to figure out how to write a grant or something like that. And Daybreak provides the data that I will need to be able to do that. That was also the thing that I mentioned, that we're trying to clean up some other procedures that we've had, like using some community agencies that just didn't have the data and didn't have a way to have easy access to that, or to be able to show that in a way that I can advocate with. So the way that Daybreak uses the platform and that portal, and the way that I get a report every week of kind of what's going on, and then the other data on the backside too. That's just going to be really important for me as I'm finding other funding sources to be able to maintain and sustain these programs.
Thanks, Abby. That's you know, I think a lot of people probably on this call can commiserate with that sort of the ESSER cliff that we're all facing right now. So we talked a little bit about funding, well, a lot about funding, but what types of barriers, you know, aside from the funding, do you feel that students accessing or asking for access to mental health supports face? And can you speak to some of what those barriers are and what you're doing to mitigate them, if anything, while also very much understanding that this type of mitigation is incredibly difficult and often complex? Jeannie, do you want to answer this?
Yeah, I think the biggest barrier is always access. For us, it's not only lack of services, but the wait time, even with our big mental health hospitals in our state. We're really struggling at time with people with really chronic, imminent danger type of behavior that is impacting some of our students. And so that barrier doesn't always, Daybreak or our school-based mental health or drug and alcohol services don't always take care of those kinds of concerns, because those agencies, just like Daybreak, is more mild to moderate concerns. But the biggest barrier is that it's a long wait time, even when kids get out of hospitals. So being able to get one of our students right in with a therapist, even though they need something more intense or wraparound services, we at least have some options. 90% of my day is trying to find the right place for the right family with the right supports. So I think it's going to be ongoing until our workforce changes. I'll be honest with you. I think we're doing a pretty good job now with getting those students with mild to moderate more access. And that has just been because we just started with Daybreak, has been this year of really having another access besides someone face-to-face, is having that telehealth option at any time. You know, not any time in the sense, but they can do it after school, they can do it on a Saturday. Again, it's about that equitable access. And that's one of the pieces, though, I'd say that not a lot of community agencies will see these kids on the weekend. I'll just be honest, they don't. So our community agencies, even though I have 7, 8 of them, it doesn't always meet everyone's needs. So that access is always the key, and the wait time to get in. So I think one of that is how do we continue to work with our students and our families of having an opportunity. And if we take care of our kids who have mild to moderate and they get the evidence-based practice of dealing with some of these pretty difficult mental health symptoms, that they won't need to go on to be into a long-term facility. So that's what I see. The work is so important in that area because we're always going to have the extreme crisis.
Yes, and that is such a good example of how mental health support and interventions can be proactive. Mariana, do you want to talk a little bit about what barriers you're seeing and how you're dealing with those barriers around access for your students?
I would have to say Jenny did a really great job. I mean, it is back to providing that connection with parents, regardless of what insurance they have, or if they have none. It's about the fact that not everybody has transportation or a work schedule that lets them leave at 3 o'clock because that's the only appointment that they were given. In their intake appointment happens to have been a month and a half away, like Jenny was saying, and now we're talking that we're back at square zero because they couldn't take it or they could not actually go there. We're able to, for us, this portion to be able to facilitate a weekend, an evening, for those that do not have maybe technology at home or Wi-Fi, they can do it at school. We have the ability to take that piece off. That barrier is off. We're not asking you to, we're not asking you to pay for it. We're not asking you to give us, at least, the way that we have it set up is, for those 12 weeks, whatever you're working on, you know, we'll do our due diligence to make sure you get. Now, you know, there are always going to be circumstances in which other things happen, but that also gives us that time that Jenny was referring to for all of the other long-term services to be able to sort of slip in and fill in that gap. Because if it's something that is moderate to severe, where, you know, it's not going to be done in 12 weeks. And we need to have a long-term plan. But if we can be proactive and prevent, oh my God, use the word prevent some of these higher level things, like, wow, what a concept. Not, you know, let's handle it before it becomes that crisis, before it becomes something that it becomes too great of a challenge. So it's providing that, like the same thing that Abby was saying, is taking those things out and making sure they work.
Yeah, I think, you know, it sounds like utilizing resources that have the ability to provide flexibility for families and students is hugely helpful. Abby, what else do you see as being sort of helpful in overcoming these barriers around access?
I think the ladies hit it on the head. I mean, the big thing that used to frustrate me when I was a school-based employee was how difficult, like how just it was overwhelming trying to get a family set up with local services, and just like how long it could take in between the referral to the setup, how difficult it could be if they didn't have a ride that day to get over there, like all of those things. And that's on top of the fact that there was probably some stigma at the beginning that we had to work past before we could even get to the referral process. So that's another thing that I do really just like about Daybreak, is that they make that part really as smooth as it can be. And really, they, at least for here, they've been taking a lot of that load off of our providers here, like our school-based counselors and social workers and nurses. Like, kind of like Jeannie was saying, like sometimes we spend our whole days trying to link people up to services. And so if Daybreak is taking some of that load off of us, that's really wonderful, because we have plenty to do.
Yeah, I think, you know, you all made such great points around creating more access, considering the multitude of barriers that school districts face and are facing, especially right now. So I want to ask one last question before we turn to some questions from the others, you know, from other people who are attending. So a lot of our attendees are in roles that are very similar to your roles. What's the most important thing that you've learned so far this school year in regards to structuring tiered supports? Jeannie, go ahead.
So I think really that tiered support, when I'm looking at a MTSS integrated mental health system, is the professional development that has to be done from our leaders who are working in the building, our principals, AP, all the way down through our teachers, that is critical for understanding and implementing according to implementation science. And sometimes you have to go slow before you go fast. Even the community agencies that are actually free in our school district, that work in our school district with MOUs, that has taken time to build. So everything takes time. And it really is that coaching around their MTSS system and how they're integrating really strong tier 1 strategies and tier 2, and also doing those pieces before you just jump in with everybody gets a tier 3 intervention or support, because mostly it takes a lot of time. So if we don't train our principals and our APs and our counselors, and we have deans and we have behavior support people, it makes it really hard to implement a really good system.
Yeah, it's always that, you know, go slow to go fast, right? I mean, we know that the needs are immediate, but, you know, we have to ensure that when we create these systems, these tiered supports, these structures, that they are capable of being strong, but also flexible. Mariana, what would you add to that?
I think that it's that idea, just like everyone here is talking about, in coordination of services and being able to work smarter, not harder. Like everybody here and everyone that's watching us probably, you know, has that same thing. We're working extremely hard to serve our students, but we want to make sure that we look at the fact that one size will never fit all. Like if we have therapists on our campus, they are going to they might be doing the assessing to make sure that they can see what other services need to be provided. They don't need to do double the work. How we coordinate all of the agencies together to just like what Jenny was getting to. How do we provide those? How do we make sure that we're bringing in all of the available resources that meet the needs of our families and the changing needs? Because many times we start with, we just heard that a kid needed X, Y, or Z. And then you start working with the family and you realize that, no, we need to bring in that social worker. We need to bring in that therapist. We need to bring in, that IEP team or assessment. We need to bring in because it's messy. That's at the end of the day, we cannot say that we just have one thing that we can do for you and that's going to work.
Abby, do you have anything to add?
Just say that I think I learned that providing mental health support, like partnering with different groups, can be done ethically and equitably. I think that does take time, like some of the others were saying. And it's so important that sometimes I think we get a little panicky, like we got to do something right now because something's going to happen and this is so important and let's just throw everything at it. But like I needed to just trust my gut and like take the time to find the things that could be done equitably and ethically.
That is so important, ethically and equitably. That is hugely important. Thank you so much for adding that. So I think we're going to take a couple questions. I have one right now. Abby, I'm going to give you this one. What does continuity look like at all schools? So you talked a little bit about, creating equity across schools and ensuring that, resources are distributed equitably, that access to those resources, all of that. So what does that look like at all schools?
And I will say we are developing. We're not quite there yet. But for about a year last year, we had a team that worked on creating a standard treatment protocol for attendance, because I think this question came up when we were talking about that. And this year we're working on social emotional behavior, and next year is something else. Like, so basically we've kind of created this whole long-term plan of creating these standard treatment protocols about like, this is what's going to be offered at all schools. And this is what every school is going to have for core and for supplemental and for intensive. And they can add things to it if they want to, but this is like a base of everybody will get this. And so we're in the process, like the attendance one rolled out this past summer. And we're learning some things, just like Jeannie was talking about the importance of training and professional development. We have not done enough. So for next year, when we're going to roll out the social emotional behavioral, we've already got plans in the works for how we're going to do the training piece of that. Because really what happened with the attendance one was they created this standard treatment protocol, but then nobody really knew how to implement it. So like we have these documents, and then we get together every month and we talk about it, but we're still not quite there with like making sure that it actually is, there's continuity, but we're getting there.
Yeah, and that's hugely important, that you're finding the holes in the first rollout to ensure that when you roll out similar initiatives or initiatives using this standard treatment protocol, that you don't run into the same issues that you're running into now. And to not have those issues happening concurrently with two different initiatives is always, a welcome respite in the world of schools, right? Because multiple problems, big problems all at the same time, are difficult. We have another question. I'm curious if any of the panel members have run into issues with stakeholders, district leadership, governing boards, et cetera, misunderstanding the difference between school-based services provided by district social workers and counselors and the services provided by MOU agencies. Our district is looking to eliminate school-based staff and trying to supplant that with just outside providers. How have they addressed this in their districts? Ooh, that's a very good and important question. Jeannie, it looks like you can answer that.
So one of the things, I think it's confusing sometimes because we have different terminology for school-based. So our school counselors are funded and then also funded by our levies if it's not funded by our state. So if you're thinking those are school based, I'm saying school-based agencies. So I'm talking about the agencies in our community that have clinics in mental health or substance abuse. that come in 1 to 3 to 4 days a week to see students. That's the school base, which is the MOU piece. I know we've had discussions about, would it save us money to hire licensed mental health practitioners, social workers, mental health, regular mental health practitioners, and then take away some of our school counselors or our behavior and family support people who also have a master's degree in something related to counseling. And part of that piece is in our state, it's required to have so many school counselors. So that's not going to happen. The difficulty of going slow is, as I have built over this 10 years, these agencies that come in, those are free. And so those MOUs are set up in a way that they don't come out of our pocket. The only costs that we have for services, if it's doing telehealth with Daybreak in the setting, is we do pay a portion of that. That is out of, again, levy money. It's not, again, state. It does not provide that funding, but it is about who's in charge of your district. So my superintendent, Dr. Dent, is extremely conscientious of our well-being of our children and knows that we need to do things to help support. 80% of our services, in the sense of community-based, what we call school-based, is truly free. We pay for Daybreak, and then our school counselors have been trained with University of Washington and Seattle Children's, a big hospital, through another pilot that was initiated through our UW Smart Center in really evidence-based practice. So CBT, cognitive behavior training, therapy, education, DBT, distress tolerance, behavior activation by some of the people who have made the best curriculum out of the University of Washington, Seattle Children's. We do that kind of training with our school counselors and our BFSs because we know they need this skill too, besides those agencies. So we don't have as much problems with the MOU piece. We have not enough space, and I saw that come up somewhere. And that is really my role, is to work with our schools. What days a week work? And then I work with the agencies, because it's a free-for-all if that building is going to do it. And we have eight agencies, so it gets messy. So some buildings have 2 to 3 agencies that come in on different days for different students. So it can get messy. You got to have someone in charge of that piece, is what I say. That's part of my role.
Yes, somebody asked what spaces your partner schools, we want to create a safe, confidential space for our students to access Daybreak at a school site. Please share how you navigated space for this service at your school sites.
So that's always a problem. But here's how important mental health services are in our district, and our APs, principals, counselors, everybody, that they find space, and it's confidential and it's secure. And that's what's known in our district, is we care about serving our kids, and we will find a space. And yes, there's small group rooms that sometimes get turned into a confidential space for a kid to do telehealth with Daybreak. And a counselor takes them there, sets it up with them, and moves on. And it happens all day long, but it can also happen all day long with outside agencies. We have them scheduled throughout the buildings and throughout the day. They may not always get the same space for each agency.
Yeah, I think that, as we start to prioritize more and more the mental health needs of our students, and as this is becoming, at the forefront of the conversation around education and access, it adds, more possibilities of creating space and time for what we know is such an important need. Let's do one more question. What spaces are your partners' schools creating for parents to be involved? Is it focus groups, communities of practice, or general meetings? Anybody can take this one. Mariana?
I'm going to take this one because that's my gig, if that's okay. Every space you can think of, from when you meet them in the morning and you see them come in, to your committees, to your school site councils, to your family centers, to your parenting classes, to your district advisory committee, to your African American parent advisory committee, to your English learners advisory committee, to the church that invited you to come in and say something on Sunday. Like, the reality of it is that if we think we know what those communications or what those conversations that we need to have look like, but we don't always know. we can assume certain things, but until we start doing some of these listening sessions and we start bringing in the community and saying, this is your child, how do we support you? What do we need to know that we don't know? Then we're just assuming things. So like in our community schools, it is a shared process. Everyone has to be at the table. And one of the things that we have really emphasized with everyone is that we're looking for those voices that don't necessarily are present, that are reaching out or that are showing up to those meetings. Because most of the time when you look around those meetings, they're the parents that are doing everything. They're not the ones we're worried about. So how do we bring those sort of silent voices back into the fold? Or how do we reach out to them? How do we make sure that we know what their needs are? So that's a lot of the work. And it's not easy work, but that's where you have to be willing to sort of meet everyone where they're at. And that's not a school building sometimes.
That is such a good point. It's not always in your school building. So you have to be willing to, do those home visits, have meetings at community centers, all of those things. And also that reminder, Mariana, that the parents are the experts on their students. We're all here to support and, the forward progress of these young people, but reminding ourselves that the parents are the experts and we need to make space for their voice. So we're just about at 4:30. So I want to thank all of our panelists. You all were so wonderful. And I know how crazy and busy it is in schools right now. So thank you for taking the time to have this important conversation. Thank you for everybody who attended to listen in. We will share a recording and key takeaways. And we also ask that you please answer the survey that's going to pop up when you leave the webinar. And again, thank you so very much to our panelists for having such a great conversation today. And thank you for all of the work that you all do for your students and for your communities.